Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having these occasional chest pains that seem to come out of nowhere. They sometimes shoot through to my armpit and back, and there's this numbness that starts at my elbow and goes all the way to my fingertips. It's really uncomfortable, and it happens in certain positions like when I'm driving or trying to sleep.
I see. How often do these episodes occur, and how long do they last?
They happen maybe a couple of times a week. Each episode can last from a few minutes to over an hour. It's pretty unpredictable, and honestly, it's starting to worry me a bit.
Understandable. You also mentioned issues with weight gain. Can you tell me more about that?
Yes, I've gained about 40 pounds since October. I haven't changed much in my diet or daily routine, so I'm not sure what's causing it. It's unusual for me to gain this much weight in such a short period.
Okay, we'll definitely look into that. Have there been any changes in your eating habits or stress levels that might have contributed to this weight gain?
Not really, doctor. My job has the usual stresses, but nothing extraordinary, and my eating habits are pretty much the same.
And how about the respiratory issues you mentioned? You said there's been an improvement?
Yes, I've always had difficulty breathing through my nose, but it's been better since I was treated for a severe sinus infection recently. The antibiotics helped a lot, although they did cause some diarrhea.
I'm glad to hear the treatment helped with your sinus issues. How long did the diarrhea last?
It went on for a few days after I finished the antibiotics. It was quite bothersome, but it's settled now.
Good to know it's resolved. Let's discuss your vision concerns. You mentioned it has deteriorated over the past year?
Right? Everything seems a bit blurrier, especially when I'm reading or trying to focus on small details. I haven't had my eyes checked yet, but I know I probably should.
Yes, it would be a good idea to get your vision tested. Now let's move on to the lab results and other tests. Your blood pressure is a bit high at 135/85 mm/Hg, which could be contributing to some of your symptoms. Your heart rate and other vital signs are stable, which is good. The blood work, including your CBC and metabolic panel, is mostly within normal limits, which is reassuring. Your cholesterol levels are a bit high, with an LDL of 140 mg and triglycerides at 180. Your thyroid function tests are normal.
So what do you think is going on with the chest pain and the weight gain?
Based on your description and the tests, the chest pain could be musculoskeletal, given its association with certain positions. However, we should keep monitoring it closely because of its nature and your family history of heart issues. As for the weight gain, it could be a combination of factors, including metabolic changes, dietary habits, or other underlying conditions. We'll need to keep an eye on your thyroid and cholesterol levels.
Okay, what should we do next?
First, I'd like to start you on a structured exercise program and a diet plan to help manage your weight and improve your cholesterol levels. I'm also going to refer you to a cardiologist to further evaluate your chest pain and ensure there's nothing more serious underlying these symptoms. We'll do a follow-up in a month to see how you're doing with the weight management and check your cholesterol levels again. If your symptoms change or worsen in any way, I want you to contact me immediately.
That sounds like a plan, doctor. I'll start with the changes and see the cardiologist. Thanks for helping me figure this out.
You're welcome. It's important that we stay proactive about these issues. I'll see you in a month, but don't hesitate to reach out if you need anything before then.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling this overwhelming fatigue more frequently. It just hits me out of nowhere, and I can barely get through my day. It's been hard managing this along with my other health issues. I stopped working because my job was too physically demanding, and I just couldn't keep up anymore.
I understand how tough this must be for you. Let's go through your symptoms and history in detail to see how we can better manage your health. Tell me more about your experiences with your liver condition and diabetes.
Well, I was diagnosed with hepatitis C a while back. I went through treatment, but it didn't work. After some tests, I was told I'm in the final stages of cirrhosis and level 3 hepatitis. I've had a liver scan and biopsy, which confirmed there's significant damage. It's probably why I feel so fatigued all the time. My diabetes isn't helping either. It's a lot to juggle with the insulin and monitoring my blood sugar.
Thank you for sharing that. It's important for us to keep a close eye on both your liver function and your diabetes management. How have you been managing your diabetes?
I take insulin glargine every day, 25 units, and metformin twice a day. I check my blood sugar levels regularly, but sometimes they're still higher than I'd like. My last HbA1c was 7.1%, so I know it's not ideal.
It sounds like you're taking the right steps to manage your diabetes, although achieving more stable control is a challenge. How about your chest pain and your medications for that?
I get this occasional chest pain. It can be pretty scary, but the nitroglycerin helps quickly when it happens. I keep it with me all the time, just in case.
That's prudent. Keeping nitroglycerin on hand for chest pain is important. You mentioned earlier about your interest in alternatives for pain and anxiety management.
Yes, I've been trying to manage my pain and anxiety without resorting to opioids and benzodiazepines. I heard about medical marijuana, but it's not available through the VA here. I just don't know what other options I have that could help.
I see. That's something we can discuss further with the mental health department to explore safe alternatives for pain and anxiety management. Now tell me about your glaucoma and the dryness in your eyes.
The doctors said my glaucoma is mild, and they're just keeping an eye on it for now. My eyes have been quite dry, though, and it's uncomfortable. I used to have eye drops for it, but I haven't used any in a while.
Keeping your eyes comfortable is also important, especially with glaucoma in the picture. We'll make sure you have the right eye drops. Let's summarize your main concerns and our plan moving forward. You've mentioned severe fatigue, managing diabetes, liver health, chest pain, and your interest in alternative therapies for anxiety and pain management. We also need to address your eye health.
Yes, that covers everything. It's a lot, but I'm hoping with the right plan, I can manage these better.
Based on our discussion and your medical history, here's our assessment and plan. Your ALT is 88 U and AST is 93 U, both elevated, which is indicative of ongoing liver inflammation. Your albumin is low at 3.2 g/L and bilirubin is elevated at 1.8 milligrams per deciliter. These results confirm significant liver impairment. Your serum creatinine is at 1.4 milligrams per deciliter and EGFR is 55 milliliter and 1.3 millisquare, indicating mild kidney impairment, likely exacerbated by your diabetes. Your fasting glucose and HbA1c levels show less optimal control. We need to continue monitoring and possibly adjust your diabetes management. Continue using nitroglycerin as needed. We should also consider a cardiac evaluation to rule out any underlying heart conditions given your liver disease and diabetes. We'll refer you to our mental health department to explore non-opioid alternatives for managing your pain and anxiety. I will prescribe new eye drops for dryness and schedule a follow-up with the ophthalmologist to monitor your glaucoma.
Thank you, doctor. It's a relief to have a clear plan. I appreciate you taking the time to go through everything with me.
You're welcome. It's important that we tackle each of these issues step by step. We'll continue to monitor your health closely and adjust the plan as needed. Make sure to keep all your appointments and reach out if there are any changes or new concerns.
Will do. Thanks again for helping me sort this out.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Based on your medical history and the symptoms you're currently experiencing, I recommend considering this procedure. It has a high success rate and could significantly improve your quality of life.
What are the risks involved with the procedure?
Like any surgical procedure, there are potential risks such as infection, bleeding, or an adverse reaction to anesthesia. However, these are relatively rare. We take all necessary precautions to minimize these risks.
How long is the recovery period?
Most patients return to normal activities within a few weeks, but complete recovery can vary. You'll need to follow up regularly so we can monitor your progress.
Do you think the benefits outweigh the risks for me?
Given your condition, I believe the benefits do indeed outweigh the risks. We'll ensure that you receive comprehensive care throughout the process.
Now look at question 26.
Good morning, everyone. Today, I'll be discussing the importance of hospital accreditation and how it impacts our facility. Accreditation is a sign of quality and reliability, showing that our hospital meets certain standards of care. Going through the accreditation process involves rigorous evaluations and frequent reviews, which help us improve our services and patient safety protocols. It's crucial for maintaining public trust and funding. Each department plays a vital role in this, from maintaining records accurately to ensuring that patient care protocols are followed. Your efforts are essential. Compliance will help us continue to provide excellent care and improve patient outcomes.
Now look at question 27.
I've noticed you've been skipping meals and losing weight rapidly. Can we talk about what's going on?
I just don't feel like eating. I don't like how I look, and I think I should lose more weight.
I understand you're feeling this way, but not eating can harm your body in many ways. Anorexia is a serious condition, and it's important to address it with proper nutrition and support.
I don't know if I can change how I feel.
It's okay to feel overwhelmed, but you're not alone. We can work on this together with our nutrition and psychological teams. Your health is our top priority.
Now look at question 28.
Today, we'll explore the ethical considerations we face in our nursing practice. Ethics are foundational to our profession, guiding our decisions and interactions with patients. Consider scenarios like patient confidentiality, informed consent, and end-of-life care. Each situation requires us to balance respect for patient autonomy with our professional duty to provide the best care possible. It's also essential to foster a culture where ethical dilemmas can be discussed openly and without fear of judgment. This transparency helps us maintain integrity and trust, both within our team and with our patients.
Now look at question 29.
I see you've been prescribed a new medication. It's crucial to take it as directed to manage your condition effectively. Are there any concerns you have about following the treatment plan?
I'm worried about the side effects and the cost of the medication.
Let's address these concerns. We can explore side effect management and check if there are generic alternatives or patient assistance programs available to help with the cost.
What if I forget to take it?
There are several strategies we can use to help you remember. For example, setting reminders on your phone or using a pill organizer. It's all about finding what works best for you.
Now look at question 30.
Welcome to the training session. Today, we're introducing a new piece of medical equipment that will enhance patient care. Let's begin with the basics of operation. First, ensure that the device is properly charged or plugged in. Here's the power button. Once turned on, the main screen will display several options. Let's go over each function and its use. Safety is paramount. Always double-check the settings before use and follow the cleaning and maintenance protocols to keep the equipment in good condition. Now let's practice with some hands-on demonstrations. Please feel free to ask questions as we go along.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Welcome to today's healthcare discussion focused on the hyperacute management of stroke, a critical and time-sensitive condition that demands rapid and precise medical intervention. I'm Dr. Emily Thompson, and joining me today is Dr. John Carter, a renowned consultant in stroke medicine. Dr. Carter, it's great to have you here to share your expertise.
Thank you, Dr. Thompson. It's crucial to discuss these developments, especially with the rapid advances in stroke treatment that can significantly impact patient outcomes.
Indeed. Let's begin by exploring a recent case that highlights the critical nature of time in stroke management. Can you walk us through the details?
Certainly. We recently treated a patient, let's call her Sarah, a 50-year-old woman who was brought to the emergency room after experiencing sudden right-sided weakness and difficulty speaking. Sarah's symptoms started abruptly while she was at work, and thanks to her colleagues' quick response in recognizing the signs of a stroke, she was brought to our hospital within 30 minutes.
That immediate recognition and response is vital. What was the initial step in her management?
Upon arrival, Sarah was quickly assessed using the NIH stroke scale, which confirmed a significant stroke with a score indicating severe impairment. We performed a CT scan and a CT angiogram, which showed a large vessel occlusion in her left middle cerebral artery an area that affects a large portion of the brain responsible for motor function and speech.
With such a diagnosis, time is certainly of the essence. What treatment options were pursued?
Sarah was a prime candidate for mechanical thrombectomy, which is particularly effective for large vessel occlusions like hers. This procedure involves threading a catheter through the vascular system to capture and remove the clot. Fortunately, we have integrated rapid response protocols that allow us to perform thrombectomies quickly. In Sarah's case, we were able to remove the clot and restore blood flow within 45 minutes of her arrival at the hospital.
Impressive turnaround. How significant is the timing of such interventions in terms of outcomes?
Extremely significant. The brain loses approximately 1.9 million neurons each minute during a stroke, so every second counts. Our ability to rapidly restore blood flow helps minimize brain damage and improve recovery prospects. For Sarah, this quick intervention meant that she could regain most of her functions, significantly enhancing her quality of life post-stroke.
That's a compelling example of why time is brain is more than just a catchphrase in stroke care. Moving beyond acute management, could you discuss the importance of early recognition and the role of the community in improving stroke outcomes?
Absolutely. Community education is key. Everyone should know the FAST acronym: face drooping, arm weakness, speech difficulties, time to call emergency services. Early recognition and action can dramatically alter the course of recovery. Public health campaigns and community training can empower individuals to act swiftly and decisively, much like Sarah's colleagues did.
Shifting focus a bit, let's talk about the role of technology in advancing stroke care. How do you see new technologies shaping the future?
Technology is pivotal. Advances in imaging techniques, such as perfusion CT scans and MRI, allow us to assess the extent of brain damage and viability of brain tissue more accurately. This guides our treatment decisions, particularly in determining the suitability of patients for procedures like thrombectomy beyond traditional time windows.
Artificial intelligence is also starting to play a role, correct?
Yes. AI is transforming stroke care by enhancing diagnostic accuracy, predicting stroke risk, and personalizing treatment plans. For example, AI algorithms can analyze imaging in real time, helping to identify subtle signs of early stroke that might be missed by the human eye.
As we look towards these advancements, what should healthcare professionals focus on to ensure they remain at the forefront of stroke treatment?
Continuous education is crucial. As new treatments and technologies emerge, staying informed and skilled in the latest protocols is essential. Additionally, fostering interdisciplinary collaboration will enhance the integration of these advancements into clinical practice, ultimately improving patient care and outcomes.
Dr. Carter, thank you for sharing your insights and experiences in managing hyperacute stroke. To our listeners, we hope this discussion underscores the importance of rapid response and advanced treatments in saving brain function and improving lives.
Thank you, Dr. Thompson. It's been enlightening to discuss the dynamic field of stroke management and the profound impact of timely, coordinated care. Here's to continuing advancements in the field.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I will be discussing an increasingly pertinent topic in modern healthcare, multimorbidity and its impact on patient care. The management of patients with multiple chronic conditions poses a significant challenge for both healthcare systems and providers, affecting the quality of care and increasing the burden on patients and resources. I'll also illustrate these points with a relevant case study from a recent patient. To start, multimorbidity is defined as the coexistence of two or more chronic health conditions within an individual. This can include a combination of chronic physical diseases, mental health disorders, and age-associated conditions. Research from Harvard Medical School highlights that patients with multimorbidity are more likely to experience decreased quality of life, increased healthcare costs, and complex therapeutic regimens, which often require careful coordination. A case that exemplifies the challenges of managing multimorbidity involves a patient I'll refer to as Mr. Smith. Mr. Smith, a 68-year-old male with a history of diabetes, hypertension, chronic kidney disease, and recent depression, represents a typical example of multimorbidity. His treatment regimen included multiple medications: metformin for diabetes, lisinopril for hypertension, and a newly prescribed antidepressant. Mr. Smith faced significant challenges managing his complex health needs, which were exacerbated by his limited health literacy and socioeconomic status. A female at knee of the critical issues we encounter with patients like Mr. Smith is what we term the burden of treatment. This term refers to the workload of healthcare management borne by patients and the impact this has on their functioning and well-being. For Mr. Smith, managing 3 chronic illnesses involved frequent visits to multiple specialists, numerous medications with various schedules and side effects, and significant lifestyle adjustments. The complexity of his situation is compounded by the need for coordination across various specialists and primary care providers. Unfortunately, the current healthcare system, often siloed and fragmented, fails to adequately support this level of integration. Harvard researchers advocate for a model of care that is more tailored to the needs of patients with multimorbidity, proposing an integrated approach that emphasizes the importance of holistic treatment plans that address all of a patient's conditions in a coordinated manner. In Mr. Smith's case, effective management would ideally involve a case manager or a primary care provider acting as the central point of communication among specialists. This healthcare professional would oversee the entirety of Mr. Smith's treatment plan, ensuring that all aspects of his healthcare are considered in conjunction rather than in isolation. Such coordination can help in mitigating the risk of adverse drug interactions, redundant testing, and conflicting medical advice. Another crucial aspect of caring for patients with multimorbidity involves shared decision-making. This process respects the patient's preferences, needs, and values, and involves them in their own care. For Mr. Smith, this would mean regular discussions about his treatment options, the risks and benefits of various interventions, and respect for his personal treatment goals and quality of life considerations. Lastly, technology and health informatics play a vital role in managing multimorbidity. Systems that provide comprehensive patient records can greatly enhance communication among providers. For example, electronic health records that are accessible to all of Mr. Smith's healthcare providers could facilitate better treatment planning and coordination. Managing multimorbidity requires a multifaceted approach that considers the complexities of individual patient cases. It necessitates a shift from a disease-centered approach to a more patient-centered framework, where the focus is on comprehensive care coordination and patient engagement in their health decisions. As healthcare professionals, our goal should be to reduce the burden of treatment and improve the overall quality of life for patients like Mr. Smith, ensuring they receive effective, personalized care.